Hi guys, my name is Dr. Colleen Long and I am a licensed clinical psychologist. I've been working in the field of bariatrics for over 8 years now, and I noticed that there are a lot of people who get nervous when they first get their weight loss surgery evaluation, especially for psych. They hear the word psych and they think that they've been referred because their doctor saw something crazy within them, or that there's some doubt that they're not going to be able to succeed with the surgery. And the reality behind psychological evaluations for weight loss surgery is simply that due to the Healthcare Reform Act, it is a required part of the whole weight loss surgery process. So everybody that has gastric sleeve surgery, the balloon, gastric bypass are all required to have the psychological evaluation. And the reason for the psychological evaluation is twofold, really. So the first part is obviously to make sure that there aren't any major mental health issues that the person is struggling with before they go through with a procedure like this. In the years that I've been doing this, I've spoke with a lot of people that have long-standing histories of depression, anxiety, panic attacks, but they've been treated. So they're either seeing a therapist or they're on medication that is effective in managing their symptoms. The things that we do not want to see are that there are active symptoms of depression or anxiety or bipolar disorder that have gone untreated, because these are often complications that can affect one's ability to be successful with this type of surgery. So there have been very, very few cases where I've actually just said outright this person is not right for the surgery, and that's usually because there is some fundamental difficulty in them understanding what I'm saying. There is lack of insight into why they're overweight in the first place, and so the message I'm trying to relay is to not be scared or nervous when you're going in to have this evaluation, because it really is to make sure that you just have the best treatment possible before you go through with something like this. The overall goal is to make sure that you don't circle back around in a year and say, oops, I didn't address the psychological issues and now I need the bypass surgery. And so that's what we're really trying to do is screen out and catch those people who might have an emotional eating disorder that is also an ongoing active symptoms of depression that is going to hinder their ability to lose weight. And then the second piece of the psychological evaluation is less evaluation and more psychoeducation in terms of giving you some behavioral modifications that help you with succeeding for the surgery. So for instance, I'll often go over just general recommendations with people in terms of switching out your dinner plates for appetizer plates. It's a nice little visual modification so that it makes the food look like it's more, obviously with a smaller plate. Practicing taking 10 to 15 chews with each bite so that you're really slowing down the process. And so as you can see, some of this stuff is really sort of almost a departure from the psychological realm and more into the behavioral realm of what will set you up to be successful with this surgery. Other things that I talk to people about are making a fundamental shift in terms of how they view food. So food is no longer the thing that we go to for comfort, security, boredom relief, relaxation, nurturance, all of the many reasons that we learn to associate with food. Food is the thing that we do to be healthy, and that's it. So just like we brush our teeth, we don't think about what kind of toothpaste we're going to use or where we're going to brush our teeth. We just brush our teeth and then we get on with our day. And that sort of needs to be the way that food is from now on, is that we look at it in terms of, this is my grilled chicken, this is my broccoli. I'm not super excited about it, but I'm doing it to be healthy. And then the things that I do get enjoyment from are things like planning a vacation or buying a new dress or spending time with my family or being able to keep up with my family, or not being asked to have an extra seat on a plane, or not being told I can't ride a ride with my kids at an amusement park. Those are the things that we start to focus on in terms of defining quality of life, and food is no longer that thing. Food is just the thing that keeps us healthy. So a lot of these things are the behavioral pieces that we talk about in a weight loss surgery psychological evaluation. And part of my evaluations are very comprehensive. I know that there are some psychologists that will just do a brief interview, but I really like the data that I'm able to get from robust psychological measures such as the MCMI, the MMPI, the MBHI. All of these are psychological tests that give me data in terms of how you take in information and what is the best way that medical providers can relay information to you. We've gotten information about patients that they may, on the surface, act like they are compliant and that they're adhering and that they're going to adhere to guidelines. And they may not, they may have a complete disregard for authority. There are people that have a difficult time interacting with medical providers because for whatever reason they're intimidated or anxious and they aren't able to take in the information. And so that tells us that it's a good idea for them to bring in a family member or a trusted friend that can help them with the questions that they have after surgery and even before surgery. There is data that we get about people, for example, that they're embarrassed about being vulnerable. They're anxious about asking for help, yet they have tension related to physical illness. And so there's this bind that's created that creates anxiety for people. So pulling out that data from these comprehensive psychological measures is really, really important. So it's not just something to be scared of or something that is meant to cause you more grief. It's actually designed to help you if done in the right way. So I hope that that helps you guys. I have created a site, schoolforselfhelp.com. School for self-help. School for self-help. Hold on. Sorry guys, I just created this today. School of Self-Help, schoolofselfhelp.com. So if you go to schoolofselfhelp.com, and I'm putting lots of self-help tools for those of you that are going through weight loss surgery, considering weight loss surgery, and even maybe if you decide that you don't want weight loss surgery, but you want to try it and give it a go on your own again. There are a lot of tools on there, free tools for you guys to use in terms of weight loss tools and help for you. So feel free to check it out, schoolofselfhelp.com, and you can subscribe to the newsletter if you're interested in getting weekly tips and support for your weight loss surgery. So I hope that helps, guys. Dr. Colleen Long, licensed psychologist, and I practice in Los Angeles and Boston. All right, thanks, guys, and good luck with your surgery.